interdisciplinary dentistry involves the intercollaborative approach of dental professionals from different dental specializations such as periodontics, prosthodontics, orthodontics, endodontics, oral surgery, pediatric dentistry, and more. It extends beyond dentistry to include other general healthcare professionals like general doctors, oral and maxillofacial surgeons, physical therapists, speech therapists, and nutritionists. So next one, what are the importance and benefits of interdisciplinary approach between dental specialists? First, comprehensive patient care. Second, improved treatment planning and outcomes. Third, it enhances predictability and long-term stability. Fourth, preservation of natural dentition. Fifth, efficient utilization of resources. Sixth, interprofessional collaboration. Seventh, professional growth and knowledge exchange. And lastly, enhanced patient experience. Success of interdisciplinary dental collaborations. Interdisciplinary dental cases in real life provides valuable insights into the application of intercollaborative approach and management of certain complex dental cases and procedures. It involves integration of multiple dental disciplines to deliver comprehensive and optimal quality patient care and services. This is our case study, interdisciplinary approach for the management of an extensive caries premolar. A 42-year-old male patient was referred to the endodontic specialist in 2016 for the management of left maxillary first premolar with advanced caries. At the time of consultation, tooth 2-4 was asymptomatic. The patient's medical history was non-contributory. Clinical examination revealed subgingival caries and initial surface of tooth 2-4. The probing depth was within normal, the tooth was not tender to percussion, palpation or biting, and it was not mobile. Pulp sensibility test was performed and failed to elicit a response. A periapical radiographic examination revealed a periapical radiolucency of the tooth. The tooth was diagnosed with pulp necrosis, asymptomatic apical periodontitis. The patient was advised for the clinical findings and various treatment options was discussed. The patient decided to proceed to the following agreed treatment plan, which was first, to perform non-surgical root canal treatment. Second, orthodontic extrusion by a section fixed appliance. And third, lastly, is the post-retained all ceramic crowns. So the patient was then scheduled for an orthodontic extrusion procedure by using a segmental arch technique, or the SAT, of fixed appliance. An orthodontic band with labial bracket was fitted and cemented on the tooth number 2-4 to allow all remaining crown structures to be protected for retention and resistance during extrusion. Brackets were bonded on the labial surfaces of 2-1 and 2-6. And after the second 4 weeks, around 2 mm of extrusion had been achieved, and this was judged to be sufficient. You can observe that in the second picture. Following extrusion, fibrotomy was performed under local anesthesia to prevent relapse. Subsequently, post-retained all-ceramic crown preparation was performed and acrylic crown was cemented as provisional crown. You can see it in the image below. And then composite button was placed on provisional crown to retain the position of the extruded 2-4. All-ceramic crown was cemented as the final restoration a week later. And then lastly, after a year, the patient was symptom-free. Clinically, the crown was satisfactory and there was no evidence of apical pathology in periapical radiographs. He expressed his satisfaction with the treatment from an aesthetic point of view. You can observe that in the last image.
The roles and contribution of each dental specialist involved in the collaboration process. The successful outcome of an interdisciplinary approach, including non-surgical endodontic treatment, orthodontic extrusion, and postodontic rehabilitation and management of an extensive cryosmodularity premolaris throughout the extraordinary ability and skills of a dental collaborative team and overall teamwork, which really works wonders. First, the role of an endodontic specialist is to perform a non-surgical endodontic in order to save a badly carious premolar, and the principle of crural effect of a prime importance, which restoring and endodontically treated tooth. Fiber posts play an important role to achieve an aesthetically favorable restorative outcome. The use of fiber posts will reduce the risk of bone fracture as its inherent modulus of elasticity closely matches that of an additive. Second, the orthodontics extrusion was recommended in this case is called maintain the crown-tooth ratio of the tooth and provide a good gingival and osseous profile which is critical in the aesthetic zone. This is will contribute an orthodontic specialist in this collaborative process. And lastly, fabrication of all ceramic crowns is done by the prosthodontic specialist and prosthetic rehabilitation to restore the function and aesthetic aspect of an expensive caries premolar with compromised prognosis.